Just to tell you a little bit about the collaborative, it's a partnership of national and local organizations, federal agencies, businesses, and professional associations that are committed to developing and implementing collective approaches that'll bring walking back as a valued cultural norm to all Americans. I want to thank those of you who are already members of the collaborative and invite the rest of you to join us. The Everybody Walk Collaborative envisions more people walking in more walkable places. It's that simple. But to make it happen, you are Everybody Walk Collaborative partners are working to make walking and walkable places more visible and more desirable. You're working together to bring about the behavioral and cultural changes that we need to make walking the new normal. I was in Australia much of August, and they just walk. It's part of their culture. They have as much transportation and car grid lights, almost as much as Washington and during their rush hour, but they walk. Just getting out of the cab, for example, to go to a place, they let us off about a block and a half away, and nobody thinks anything about it because the other way was a one-way, and they just walk. To go get a cab, they walk a block or two to a cab stand. It becomes part of your thinking and part of your everyday life. So together with you, we're trying to promote walking in local walking programs, showcasing successful walking campaigns, and pushing for public action that will increase the number of safe walking environments. Again, our mission is to get America walking and get all of America walking. Walking enough to maintain optimal health and walking for plain old regular transportation to get from one place to the other. Very simple. Just use your legs and your feet to move. It doesn't take a brain science or survey to tell you. It'll get you where you want to go. We also are working to make sure that all places, neighborhoods, and communities are designed and built so that walking is safe and it's fun and it's routine. We want every state to have an effective walking advocacy network. So if you don't have one in your state, I hope you'll be the person who starts it. So as the National Honorary Chair, I look forward to being a public voice for this meaningful and very important issue and helping to guide your efforts and your collaborative efforts, the things we're going to get out of this meeting and others like it. And I'll be speaking out about the numerous benefits of walking, things you already know, that it's good for our health, it's good for our environment, it's good for our local economies, and most of all, it's good for our social fabric of our communities. Since leaving government, many of you have asked what I've been doing, so I want to just take a minute to tell you that I'm continuing my mission, and the way that I'm continuing my mission on prevention is I'm at Xavier University in Louisiana, the NOLA.com Times-Picayune Endowed Chair for Public Health. Many of you know that Xavier University, for the last 30 years, has been #1 in getting African American students into medical school and graduating from medical school. They've also been #1 in getting PhDs in physics, biology, and other sciences. So this was a prime opportunity to create a school, actually a department of public health to offer baccalaureate degrees, not master's, but baccalaureates in public health, to get these students early on interested in the community before they go to medical school, and tremendous. We hadn't even started much, and we had 32 students already interested. So getting them early on. And needless to say, their first project is a community walk with the president of the university in the city of New Orleans, and that's October 23rd. So I hope that many of you will join us, and we have ideas on the ways to do that. I'm also continuing my clinic in Alabama, Biola Battery. It's only an hour and a half away. So we'll be doing walking there, so I'm on the Gulf Coast, hour and a half to the clinic and whatever. Many people think that the South doesn't do much walking, but we do. In fact, when I rebuilt our clinic after Katrina, we built a walking trail around the clinic. And I was there on Friday, and there's a group of Vietnamese women walking every day during their laps around the building. And there's a businessman in a suit walking, and now others have joined them. Just the fact that they see them every day, they started joining them. One of my neighbors is here someplace from Fairhope, where I went to high school. We have about 15 to 20 miles of walking trail, walking path that goes along the bay, the water. It's beautiful. People use it every day. We are starting to do that, but we need more, particularly in our rural communities. And we've talked a lot this morning about the inner cities, but we also need it in our rural communities as well. I hope that the organizations here will start to find ways to work together, to do some virtual walks. So when we're doing our walk in New Orleans, maybe we can get you to virtually walk wherever you are, and we can find some kind of technology to kind of link ourselves together, have some fun competitions, and of course we'll win, but you know. I know the American College of Sports Medicine is here, so I hope that we can get the doctors to do things like American College of Sports Medicine has the Exercises in Medicine program, but they're physician organizations that are members, to have walks with the doctor, perhaps Wednesday walks with their doctor, just going around either in the neighborhood or something. People like to have that kind of interaction and the leadership we can have from the physicians. And I could talk to you forever, but basically I want to tell you that I'm easy to reach. It's not hard. You can reach me through the Everybody Walk Collaborative or just reginabenjamin.net. But I want you to know that you're leaders, and you're the leaders in this particular collaborative. You're going to get America walking, and that's what we want you to do. But while you're leading, make sure you take care of yourselves. I always want to tell you that you got to look out for yourself. On the flight here, the flight attendant said, put your own face mask on before attempting to help others. You got to take care of yourselves. That means you got to walk. You've got to exercise, play, have fun. And it's flu season, so take your flu shot. Make sure you do that. And I'm going to end with a poem that many of my friends here have heard me say many times. It's called God Meant It, and it's by an unknown author. But it goes like this. I have only just a minute, only 60 seconds in it. Forced upon me, can't refuse it, didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, yet eternity is in it. I hope you will take your God minute and continue to make a difference and take a minute to walk. Thank you.